Hey everyone, my name is Damian Garcia. Today I'll be lecturing on epiphyseal fractures. I'll be going over what it is, what causes them, the symptoms that you might expect in this type of fracture, the 5 different types of epiphyseal fractures that there are. I'll also be giving you guys an acronym to help you guys remember these type of fractures. And then I'll also give you the type of treatment methods that are expected with this type of injury. Alright, so let's hop right into this. Now, if you've never fractured or injured any type of bone, I could tell you from experience, it's excruciatingly painful. I've fractured my right elbow and my left ankle. Not at the same time, of course, but just being a kid, I had my fair share of bumps and bruises down the road. People tell me that dislocation hurts way more than a fracture because I've also dislocated my right knee. But I beg to differ. I think fractures hurt way more than dislocations. But enough of that. Let's get into epiphyseal fractures. So, what is an epiphyseal fracture, you may ask? Well, an epiphyseal fracture, by definition, is when the epiphyseal plate, also known as the growth plate, is separated from the epiphysis or the diaphysis, and this type of fracture can disrupt the normal growth of a bone. These type of fractures are also known as growth plate fractures. Alright, so just a quick overview on these fractures. These are most common in children ages 10 to 15. An injury that might cause a joint sprain for an adult will cause a growth plate fracture for a child. These fractures are also twice as common in boys than in girls, and this is because girls finish growing before boys do. This type of fracture also affects the layers of growing tissue near the ends of the child's bone. The growth plates of a child are the softest and weakest sections of the child's skeleton. They can affect how the bone will grow, and an improperly treated growth plate fracture could result in a fractured bone ending up more crooked or shorter than its opposite limb. Obviously, for a fracture, immediate treatment is needed. Now, the most common sites for these injuries are going to be in the wrist, which is 50%, and the ankle, which is 30%. So, what causes these type of injuries? Well, a fall or a blow to the limb, such as a car accident, even competitive sports such as football, basketball, or gymnastics, and even recreational activities such as biking, skiing, sledding, and skateboarding. And I actually have a friend who, when he was fairly young, got into a car accident, and the distal end of his femur was fractured. So it led to him having a shorter left leg than a right leg, and he has to wear a little pad in his shoes to keep him from walking awkwardly. Now, overuse can also be a cause of injury, uh, such as little league pitching. For an example, many little league coaches don't let their pitchers exceed a certain amount of pitches so that they don't damage the distal end of their humerus. So now I'm going to talk to you guys about symptoms that you might expect to have with an epiphyseal fracture. The first symptom being pain or tenderness, and this is particularly in response to pressure on the growth plate. Another symptom being is the inability to move the affected area, and you'll also have the inability to put weight or pressure on the affected area. Warmth and swelling at the end of the bone near the joint is also a common symptom seen in an epiphyseal fracture. So for these next couple slides, I'm going to be going over the 5 different types of epiphyseal fractures, and I'm going to go over how they fracture, what might cause these fractures, and the type of treatment that might be needed for these fractures. These fractures are physeal fractures, metaphysis and physis fracture, epiphysis and physis fracture, and epiphysis to metaphysis fracture, and finally a crush fracture. So let's hop into the wonderful world of fractures. Now, a type 1 fracture is a physeal fracture, and it's basically when the epiphysis separates from the metaphysis. Just a quick reminder, the metaphysis is the shaft of the long bone, and the epiphysis is the end of the long bone. As you can see, there's a picture on the right, and it's basically a clean break. The germinal cells do remain on the epiphysis, and if the periosternum, which is the outer shell of the bone, is torn, displacement may occur. These type of fractures are pretty common. They make up about 15 to 30% of child bone injuries. And the healing process is rather quickly. It takes about 2 to 3 weeks for the bone to heal. And problems are rare in this type of fracture. So the next type of fracture is a type 2 fracture, also known as a metaphysis or physis fracture. And it starts horizontally just like a physial fracture, but instead of going completely straight through, it's completed by exiting through the metaphysis. As you can see, the picture on the right indicates how that fracture works. So it's going straight, and all of a sudden it cuts upwards and out of the metaphysis. This type of fracture is the most common type of fracture, and in some cases there is a torn periosteum that may be trapped in the fracture site. And the way that they release this trapped periosteum is going to be through open operation. These are most commonly seen in the ankle. The fracture that I'm going to talk about is an epiphysis and a physis fracture. It's a type 3 fracture that's commonly seen in older children because their growth plates have started to close. Now, what it is it's a combination of horizontal fracture line through the physis and a vertical fracture line which runs from the growth plate through the epiphysis. Uh, in some cases, displacement may occur and an ORIF is needed. Now, ORIF is an open reduction internal fixation surgery, and basically what it means is the surgeon makes an incision to realign the bone, and then the internal fixation part of the surgery means that the bone will be held together with hardware such as metal pins, plates, rods, screws, and after the bones have healed, the rods or hardware just stay there. So next up, we have a type 4 fracture. And the type 4 fracture is an epiphysis to a metaphysis fracture. And what this is it's a fracture line that runs vertically through the epiphysis and the metaphysis. And this type of fracture travels through 4 distinct tissues or areas. The first area being the metaphyseal bone, second, the physeal cartilage, followed by the epiphyseal bone or cartilage, followed by the articular cartilage. And just like a type 3 fracture, these type 4 fractures might be displaced and they might require an ORIF. And the 4 injured areas must be accurately reduced and lined up to each other to minimize risk. Also, with these fractures, long-term follow-up is going to be needed to detect any growth disturbances. And if you look to the photo on the right, it'll show you how the fracture runs through the epiphysis and the metaphysis. So finally, we're going to talk about the type 5 fracture, which is a crush fracture. And this is the rarest of them all. They account for less than 1% of growth plate fractures. These are also very difficult to see on an x-ray. These injuries are almost always diagnosed retrospectively when the growth arrest has occurred. And basically this type of fracture just crushes the growth plate. You can see the picture on the right indicates how the growth plate is smashed in between the metaphysis and the epiphysis. Now I'm going to talk to you guys about SALTER, which is the acronym that'll help you guys remember these type of fractures. The S in SALTER stands for straight across, which is the type 1 fracture. Then we have the A, which is for above, which is the type 2 fracture, followed by the L for lower or below, which is a type 3 fracture, followed by the T, which is to or through, which is the type 4 fracture, and ER for erasure of the growth plate or crush, which is a type 5 fracture. The picture on the right will show you a normal bone compared to the different types of fractures that you'll see. So you can see that there's the straight across in type 1, above in type 2, lower or below in type 3, and to or through in type 4, and in type 5 you don't see the growth plate at all because it's been crushed. Now the type of treatment someone might get for these growth plate fractures all depend on several factors. These factors include which bone is injured, the type of fracture that it is, how much of the broken bone ends of the bone are displaced, the age and health of a child, and any associated injuries. So there's non-surgical treatment and surgical treatment. As for non-surgical treatment, it's basically immobilization where a cast is applied to the injured area of the child and limits the type of activity that they might do. Now for the surgical treatment, I spoke about this briefly. It's called the open reduction internal fixation. And like I said before, it's Basically, the surgeon goes in there and puts in either screws, rods, or any type of hardware to keep the bone aligned. Lastly, here are my resources that I used to conduct this PowerPoint, so a special shout out to them. I'd also like to thank each and every one of you for tuning in and listening. Apologies if you hear the little baby crying in the background. My girlfriend just delivered our baby boy on Friday morning, so apologies for that. But like I said, thank you guys all for tuning in and listening. I look forward to listening to everybody else's projects. Uh, Thank you guys again.